Hi guys, good morning. When you're sending your patient for a CBCT scan, it's really important to make sure that you have a radiographic stent prior to the scan. And I'm going to show you one stent which we just made in 5 minutes and it was super easy to do. So if you take a look at his old denture, all we have done is use the foil inside one of those old X-ray films and we've stuck it on there with some glue and we're going to get this scan taken. So now we know exact markers of where the teeth positions are going to be, and this is something that gives us much more usable scan data. Once the scan is completed, we're just going to take off these markers, clean it up, polish it, and he has his old denture back while we our implant planning. So remember, if you're doing CBCT scan, always fabricate some type of radiographic stent. Alright, so let's take a look at the scan now that that's done. So if we look at the scan, you can see those markers have come very clearly. There's 1 here, 2, 3, 4, 5 and 6. Ignore the meshwork of the denture and we are able to plan implant placement. This patient will be receiving a removable prosthesis, so we will try to sneak in probably one more implant in this region for a better spread. But then at that point, with 3 implants, we may even consider doing a fix. So this is very much in the treatment planning phase. The point of this is the importance of the radiographic stent. And till the next time we meet, take care and have a nice day.